So I'm going to be talking about chapter 19, which is on adverse effects. And I'm specifically obviously going to be looking at the searching aspects within this chapter of looking for adverse effects. So if I begin by introducing myself, obviously I'm Sue Golder. I'm an IRMG member and a co-author of the adverse effects chapter of the Cochrane Handbook. My background, I am a senior research fellow at the Department of Health Sciences at the University of York in the UK. I'm also co-convener of the Cochrane Adverse Effects Methods Group, and that's our Twitter handle and web address. My research interests, obviously adverse effects, systematic reviews and literature searching, also unpublished data and social media research. So for today, I was going to talk about three different aspects, all of which are covered in the chapter 19. The first of which is the importance of adverse effects. Secondly, the issues with searching for adverse effects that are specific to adverse effects. And lastly, to look at approaches to searching for adverse effects, particularly those that I would recommend. So if we begin by thinking about the importance of adverse effects. The definition of an adverse effect that is included in the Cochrane Handbook is an unfavourable or harmful outcome that occurs during or after the use of a drug or other intervention for which there is at least a reasonable possibility of a causal relationship between the intervention and the event. I think there's two important things to consider here. One is it's not just drugs, it's all interventions. Any intervention that can have an effect can have a positive or negative effect. So unless your intervention does nothing, then it has the possibility of an adverse effect. The other important aspect is the reasonable possibility of a causal relationship. So it might not be necessarily that you got run over by a bus after taking a drug, might not actually be related to the drug. But we don't have to have 100% certainty either that it's caused, but just a reasonable possibility. What is the current state of play? Well, with Cochrane reviews and reviews in the published literature, we find that those that cover adverse effects tend to be drug reviews, and it's often excluded from reviews of other interventions. The handbook clearly states, however, that a Cochrane review that considers only the favourable outcomes of the interventions without that it examines, without also assessing the adverse effects, will lack balance and may make the intervention look more favourable than it should. The bottom line is that we should always consider the adverse effects. This is particularly increasingly important as there's often for a disease or a condition, there can be many treatment options available, and the adverse effects may be the deciding factor to the patient or clinician. So hopefully you're all keen to now search for adverse effects because you understand how important they are. Well, I'd now like to talk about the issues. Many of the issues are the same as you would get with searching for efficacy studies. So many of the issues, but there are some that are special issues when searching for adverse effects. A particular concern is the poor reporting in the titles, abstract and indexing of bibliographical databases. This is because adverse effects are often a secondary or even tertiary outcome in the primary studies, and therefore aren't in the title and abstract and indexing, although there may be some really good information in the full text. There's inconsistent terminology and indexing. There's lots of different terms for adverse effects, adverse events, adverse reactions, harms, safety, complications, undesirable effects, side effects, etc. Although these terms all have slightly different meaning, they're often used interchangeably and often used incorrectly, and this doesn't help matters when you're searching. Another issue, depending on the type of question that you're trying to uncover, is that you may wish to identify all the adverse effects for a certain intervention. But this is really hard to predict and plan at the outset. So you don't know what you're actually going to search for. So it's really then difficult to put in your search terms if you don't know what you're looking for. And lastly, but not least, and often is the case that a range of study designs are needed to answer questions on adverse effects, not just randomized controlled trials, for which we've already heard that there's good ways of searching for RCTs. Other studies designs are often harder to identify. However, RCTs aren't necessarily the gold standard for adverse effects. They often exclude those susceptible to adverse effects, or they don't have long enough time of follow-up to identify those long-term adverse effects, and they're often powered for efficacy. So they're not large enough to identify rare adverse effects. So what are the best approaches to searching for adverse effects? The first thing to highlight is that it's very rare that a single search that retrieves studies evaluating both benefits and harms. And it's in the Cochrane Handbook, it is not recommended to do a single search. The only instance when I think of that it could be feasible is where you have a very new intervention or an intervention that has very little studies out there, and so you're only searching on the intervention in your search strategy. But let's face it, that's quite rare. The reason we need often we need two searches is because study designs to evaluate adverse effects may be different to those reporting efficacy. As I've already alluded to, RCTs are not necessarily the only study design that you would look for when searching for adverse effects, but they may be the only study design for efficacy. Adverse effects are also not necessarily limited to the condition or type of participant. So there are lots of drugs, for instance, that are licensed for more than one condition, and the adverse effect can occur independent of which condition it's prescribed for. So you might not want to search for your P element, your participant or population of the P code. So it's therefore more likely that we'll need separate searches. Thinking about where to search, well, sources to search are very similar to those that you search for with efficacy. So, for example, performing a Medline search alone is not recommended, just like it's not with efficacy. There are a wide breadth of sources needed to ensure that you have identification of the relevant data for adverse effects. Something I would like to highlight, though, is that unpublished sources are particularly important for adverse effects data. Though I agree that they're important for efficacy data, I think they're more important when you're talking about adverse effects. And this goes back to what I said about adverse effects often being secondary or tertiary outcomes. So for the same study, in the publication version, they might miss out the adverse effects, whereas the adverse effects data may be all there in the unpublished version of the same study. Particular examples of unpublished sources that are good for adverse effects are clinical study reports for drugs and biologics, also trials registers and regulatory agency websites are good for adverse effects. I've already mentioned slightly the PICO. So when you're planning a search for efficacy, you often search for the P and the I, so the population and the intervention. Whereas with searching with for outcomes, you often limit your search to the intervention and the outcomes, so the I and the O, because the outcome is the adverse effects. Now, searching for the intervention is the same as when you search for the intervention in an efficacy search, but you rarely search for outcomes in an efficacy search. So let me talk about searching for the outcome or the adverse effects. Now, how you approach this depends on your type of question. And basically, there's 3 types of approach to doing a review of adverse effects. So there's the confirmatory approach. This is where review authors list 1 or more adverse effects as outcomes of interest in their review protocol. There's the exploratory approach, which involves extracting any or all of the adverse event data found within the included studies. And then there's the hybrid approach, which combines elements of both confirmatory and exploratory approaches to capture anticipated and previously unrecognised adverse effects. So I've got some examples here that are real Cochrane reviews. So for the confirmatory approach, here we have a named intervention or contraceptives with a named adverse effect, either venous thrombosis or effects on weight. For the exploratory approach, these 2 examples are just looking for all adverse effects, whether they call them adverse side effects or adverse events. They're looking for all adverse effects. So, so searching on your outcomes will be dependent on your type of question. You may want to look for named adverse effects such as headache, death, insomnia, weight gain, persistent cough. And this is the same as any type of search where you would search for text words and indexing terms, and you would use both, as Carol alluded to. Generic adverse effects terms are also really good to search for. These are things like the harms, side effects, adverse reaction, adverse effect, adverse event, etc. that I was alluding to earlier. So these, again, can be searched for as text words and indexing terms, but also as subheadings, which I'll just refer to in more detail. And we also have a few search filters or hedges to help us with our searching for adverse effects. So here's an example Medline record. We have adverse events as a text word in the title. You could also find this record by searching for the index term adverse drug reaction reporting systems. And another way to find this record is by searching the subheading adverse effects, which actually occurs numerous times within the whole record. I've already mentioned a few of the examples of the adverse effects terms that you can use. This is just a slightly more comprehensive list, but a word of warning, some of these will give you a lot of noise, a lot of false hits. For instance, risk, there's lots of talk of relative risk, obviously, risk of bias. With the term harm, you get lots of papers about self-harm, and there's also lots of patient safety literature, which you'll retrieve with the term safety. And for some reason, there are a lot of abstracts that say something like adverse effects were not considered, which obviously you will find with the term adverse effects. As with indexing terms, this is examples of mesh terms, but I think it's similar for Embase as well, in that you need different types of indexing terms depending on your intervention. For example, if you're searching for surgical adverse effects, you often need to use words for complication, for example. If you've got a medical device that you're looking for the adverse effects of, terms of failure and safety and recall and withdrawals are more common. And drugs, again, there's some specific terms for mesh terms for drug adverse effects. So really do think about the type of intervention that you have. So I said I would mention subheadings. Well, there's two ways of searching subheadings. The first is attached to the intervention. So this could be attached to the intervention, or it could be attached to the adverse effect. So we've got aspirin, adverse effect, or we've got headache, chemically induced. Two great ways of searching for with subheadings for adverse effects. What I find often is a better way, however, is to float my subheadings, which means my subheadings are attached to any indexing term. I've got some examples here for Ovid Medley. Unfortunately, not all databases allow you to float your subheadings, but where you do, where you can, it is really useful. So in summary, you're likely to be required to undertake separate searches for your adverse effects and your efficacy. This is because for the efficacy search, you're more likely to search for the P and the I of PICO, and for adverse effects, the I and the O. The search process, however, needs to be reported fully for both types of searches. So it's not good enough just to report the efficacy searches. You need to report the adverse effects searches to the same standard. That is, they should be transparent and reproducible. Depending on your question, whether you search for generic or specific adverse effects terms, and there are lots of different synonyms out there, which I've mentioned. And then last, there are different approaches to searching for adverse effects, depending on the type of intervention. And I've mentioned drugs, medical devices, and surgical procedures do have different types of words that are used for adverse effects and different types of indexing. So obviously there is guidance out there in the form of the Cochrane Handbook, which should be your first port of call. I have published an overview paper, however, that goes into a bit more detail just about the searching aspect of that chapter. Has a lot of overlap with the Cochrane Handbook, but does go into a little bit more detail about searching. And then there are 3 search filters published in Hilge, one for adverse drug reactions, one for surgical interventions, and another for medical devices. And I do realise the drug adverse effects filter is very out of date, and I am in the process of trying to update that. Okay, so that's what our website looks like, and I'd now like to invite questions.
Brilliant. Thank you very much, Sue. Okay, so we're just waiting for some questions to come through in the question panel. A quick question before they do start coming through from me is that where you showed the different approaches to searching for adverse effects outcomes, are there certain review questions that would be where it would be beneficial to use a certain type of approach over the others? I noticed when it showed the exploratory approach that they seem to be reviews of adverse effects, for example.
Yes, the exploratory approach, you're more likely to rely more heavily on your generic terms and you're floating your subheadings, whereas a confirmatory approach, you're much more likely to name your adverse effects and all the different synonyms and use text words and indexing. But often I find using both is good too. So if I was searching for all adverse effects, I would maybe search for those generic terms such as harm, safety, etc. But also if I knew of any adverse effects, I would add them too. So I often search for death, for example, because obviously that's the worst adverse effect, arguably, that you could get. And I often put that in a search strategy. because we know it's an adverse effect, but also with sort of medical, surgical procedures. I would always anticipate that pain would be an adverse effect. So add that to my search strategy as well as the generic terms such as failure or safety, etc.
Brilliant. Okay, so the questions that are coming through. Imelda asks, does the Cochrane Handbook list the various websites for finding search filters and hedges?
The Cochrane Handbook has it got links to the ISSG websites? I would guess that's the Julie or Carol in the other sections. There isn't much about the filters listed in there, but there's only those 3 for adverse effects that I know of that I've mentioned. But the ISSG website contains a comprehensive, up-to-date list of all filters. So I go to that.
I can see that
Carol, I can just add to that if you'd like to. The Handbook Chapter 3.6 is the one in the technical supplement that refers to search filters and goes into all the background of them. As Sue says, there are only 3 particular search filters for RCTs that are published within the handbook, but it gives a lot of information about why and how to use the search filters, together with the information that Sue referred to, as did Andrew, about the ISSG search filter resource.
Brilliant. Thank you, Carol, and thank you, Sue. We have a question that's come through from Paul, who asks, hedges have been mentioned along with filters by a couple of speakers today. What's the difference?
I thought hedges was what the group in was it the Health Information Resource Unit, McMaster called filters, but I call them filters because I've always thought hedges sounds a bit weird, but I think it's just a cultural thing. I don't think there is actually a difference. They're just used interchangeably. But I think in Canada they like the term hedges. But personally, I prefer search filters because it sounds like what it does. So, if that makes sense.
Yeah. Carol, did you want to add anything? I noticed you've turned on your camera.
I just wanted to add to what Sue had said by saying that even the so-called hedges team, operating under Brian Haynes at McMaster, as Sue has mentioned, even they more recently are referring to search filters. So even within the so-called hedges team at McMaster, it's very much a historic name. And the only people who call it hedges, other than them, are calling it that because they've heard McMaster calling it that. But I don't think anybody else particularly uses the word hedges. As Sue says, they are search filters, whether they're designed by McMaster or not, and that's what the rest of the world calls it. But I see that Andrew has turned his camera on, so I'm going to invite Andrew to comment too.
Thank you, Carol. Yeah, I agree with you. The only thing that I would add is that for some time I was trying to get people to accept that hedges might refer to these subject based terms and filters be used for the methodological ones, but then along came the McMaster team and they drove a bus or whatever the Canadian equivalent is, a Greyhound or whatever, through that distinction. But I think it is helpful when talking about these things to distinguish between methodological filters, which are focusing on the study characteristics, and the, if you like, filters that might focus on the other parts of the PCOS, so the PICO elements. But as I say, that was a sort of a bit of a King Canute's job there.
Brilliant, thank you, Andrew. And we have time for just one final question. So back to Sue. What are your thoughts on Embase triple headings that include adverse effects elements?
Yeah, they can be useful. that the if you've got embase.com, the filters are there. So I would prefer to use them. The triple indexing doesn't always work as well. It's good for preliminary searches though, scoping searches, I think, so when you're just looking to see what's out there. In Embase, they also have the advantage of an indexing term for medical adverse effects of medical devices, which they don't have in Medline. But I have been working with Embase to try and improve the situation, as that also isn't as sensitive as we would like. So is that polite enough? So yeah, I still think it's good. It's just maybe not as sensitive as we would need for when you're at the later stages of a systematic review. But at the preliminary stages where you'd like devising your protocol and stuff, it's quite handy.